It's as always such a great pleasure to be here. Probably this is my 7th or 8th time in a row in Cape Town and SAPICS, and it's always great to be here. My name is Samer, and this is my colleague Grant, and we are here today to present a very interesting case study on the supply chain, healthcare issues that had been happening recently on the Middle East. Right? So we really have a packed agenda for what we want to say. We will showcase what we think is why public healthcare should care more about supply chain. In fact, supply chain, as I heard today in the morning, is the lost child of public healthcare. Right? So today we're going to talk about an implementation that took place, and it was guided by governments and humanitarian organizations together to better enhance the supply chain functionality in one of the countries. And this all started, let me give a background to this. This all started when an individual, a citizen, called up the public radio and complained about the availability of medication for his daughter in one of the hospitals, or one of the public hospitals, which later on turned to become a public issue, right? So the Minister of Health in that country wanted to understand exactly what is going on and why do we run out of rotavirus vaccinations, for example. And he wanted to have the aid of the WHO in that country. They met together, they discussed the issue, and the guys from the WHO said, Mr. Minister, this is a supply chain thing, simply, right? So he said, what do we do about it? They wanted to run a whole assessment for an entire country supply chain in the public healthcare sector to understand what is going on, why this country is running short of medications. Right? But let's a bit of background here on what is really public healthcare is about. Public healthcare is about well-being. Public healthcare is about preventing health issues. Public healthcare is about saving people, controlling of infection, and so on. Public healthcare is about enhancing the care experience, advancing health, and so on. But then when it comes to reality, what happened post-COVID outbreak is that supply chains got exposed in the healthcare system. All right? The COVID outbreak was kind of stress test to the healthcare supply chains. All right? As a result, we saw many hospitals running out of medications and still doing so, poor forecasting issues, availability of material, and so on. So governments started to think in a different way, what could be done to enhance that? Right? This is a study that was conducted by Deloitte and actually it perfectly fits post-COVID outbreak as well, about how supply chain leaders navigate their issues and challenges within the COVID outbreak. And I think all of us can recognize these issues in everyday supply chain, and public healthcare is part of this. So demand forecasting issues, visibility issues, labor issues, data issues, and so on, all of which you will see today in our case study, actually. All right? So just to start with, Grant will take us into a bit of background about the maturity assessment that we have done, and then we'll continue to talk about the solutions, the projects, and so on. Grant?
Sure, thank you so much, Samer, and I'm excited for all of you to hear about this great case study that Samer worked on. Before we go into that, please can you take out your phones and respond to this poll at pollev.com/ASCM. And I'm a little bit scared of what the answer is going to be to this question, but as a public healthcare beneficiary, so someone who's going into a public hospital, for example, please rate your overall satisfaction with your country's healthcare services. So I don't want to preempt an answer here, but let's have a look at what we get to.
Excellent, good, fair, unsatisfactory, and bad.
Yes. Oh, looks like we have some sort of, oh, there we go. All right, so far one person has said unsatisfactory. We've got one person at fair. Let's see where else we get to. Okay. All right, we'll wait for a couple more responses from you. Okay, interesting. Okay, so I expected actually more bad, but definitely unsatisfactory is the general consensus, right? So maybe I was a bit pessimistic. And even some saying fair, to be honest, as well. Quite a lot of fair. So good, I'm glad that you responded to that. Definitely, we don't have here anyone saying that their experience has been good or excellent at a public healthcare facility, right? So keep that in mind as we go through this journey. So what I want to talk about a little bit is the actual model that was used in this specific case study. So the background of this model is called the Global Health Maturity Model. And this was developed with ASCM a couple of years ago using funds that were provided by the Bill and Melinda Gates Foundation. And the model was used for specifically assessing the impact of aspects of the supply chain within a healthcare environment, public healthcare environment. So this is the model that has been used in various different contexts in the past, and is the model that has been applied into this case study as well. What it really covers is key focus areas. There's about 20 areas of this framework or this model in total, but to summarize them, it's really about being patient-focused and how do we provide patient-focused healthcare where the patient and not the customer or the consumer is the key area. It's all about availability as well. When we look at healthcare supply chains in particular, reliability is an attribute that comes out quite strongly, right? Greater than cost, greater than being agile, getting the product to the customer when it's needed, on time, in full, correct documentation, correct quality. Okay, and keep that in mind for some of the outcomes of the findings. Competencies, which is the healthcare worker capabilities and skills. So how skilled are the people that work within the healthcare framework? We see this quite a lot. A pharmacist, even, with someone with a pharmacy background actually doing full-on supply chain planning and inventory management, right? And then public healthcare infrastructure and facilities, so the actual physical facilities that these entities operate in. Really quickly, what this model does is look at the level of maturity for a public healthcare supply chain and puts it into different categories. So we have these names here: canvas, bronze, silver, gold, and accredited, right? To give yourself a score and see where you sit within that score. What it also does is look at constraints. So what are the constraints that is preventing that healthcare supply chain or that site from actually achieving a further more higher level of maturity? So this is how the basic outcome of the model looks. These are some of the assessment pillars, not to go into the detail of this, but these pillars were actually developed looking specifically at public healthcare supply chains, right, and entities within that. And then for each category, the assessment also identifies specific constraints, right? So these are some examples of constraints. Is it technology that's constraining us from being more mature? Is it human resources, the labor, the infrastructure? Is it government support, or is it even funding? These are some of the examples of constraints, and these are some of the constraints that were identified within the actual case in this project. And here's just an example of showing what it looks like for the ratings and levels. In reality, it's a lot more detailed than this, but this just gives you a snapshot showing what it means to be at a canvas level as a public healthcare entity, or what it means to be at a gold level, for example. So you can see the level of maturity sitting at very basic, all the way up to accredited, having consistently performing supply chains. It's okay to say, let's get a hole-in-one, but you need to get a hole-in-one consistently to actually be at that accredited level. So that's really a key step there. What the model also does is actually it's not just qualitative, but it has a very strong quantitative aspect as well. And that quantitative aspect is looking at metrics and KPIs specifically related to product availability, which is an important metric in a healthcare supply chain, and it assesses where this entity sits for that. So a very interesting and solid structure that exists within this model. And then what do we do with the model? So the intent was always to get out this result, right, saying how mature is this specific site, a hospital, a clinic, a warehouse, for example. And then how do we close the gaps? So as with any consulting project, now we go back to really solving the gaps, putting in place projects, putting in place timelines, putting in place a roadmap that can help an entity to actually close those gaps, measure the performance, and ultimately redo that analysis again. So that's the intent of this framework and model. So back over to Sama to give you a little bit more detail.
The overarching goal why we wanted to do this assessment on a country scale is that we wanted to build a healthcare supply chain system that's fit for purpose. The government realized and the minister realized that they cannot continue the way it is today. And there's something that needs to be changed for the next generations. So that's the overarching goal that was put by all the stakeholders, WHO, ICRC, public procurement, and then all the healthcare related stakeholders, actually, and also to embrace a better path forward leveraging supply chain, right? And for this, we started looking at a whole project and a big program of implementation and improvement using the methodology assessment, okay? And just going back, I want you to keep an eye on the different levels of maturity, you know? So canvas is the lowest, bronze is a bit higher, silver is even better, gold and accredited is a very high maturity of supply chain, right? So how did this project go? Basically, we do a classic consulting approach where we move from try to understand the as-is situation of the public supply chain, public healthcare supply chain, then understand the size of the gap that we have, and then put what we think is what is the right projects in place to enhance this, a plan, a roadmap, then try to implement all these recommendations in place, which is a classic approach towards solving clients' issues and so on. This is the entire project map. So we started with meeting stakeholders. And this is a bit complex from a country perspective because stakeholders are the drug authorities, stakeholders are the government itself, the joint public procurement for drugs, WHO in place, other humanitarian entities as well, all came together to try to synchronize what is really needed and what needs to be done in this project. Right? So we started by the project setup, meeting those stakeholders, identifying the size of the project and the entities that we need to assess, trying to understand the size of the problem and so on. And in order to implement that, the assessment itself for the healthcare sector, we needed to have assessors training because using the assessment approach requires huge efforts and assessors that understands what does it feel to go in a place, try to understand the as-is, and then try to understand the gap and try to seek evidences and so on. So we had every stakeholder propose that we have 4 to 5 different employees from every entity, joint procurement, drug federation, WHO, ICRC, and so on. We get them all together in one place, and we conducted 5 days training, intensive training on how to collect evidence on supply chain, how to assess a current state, how to use the maturity assessment documentation, and so on. And what does it feel like to be an assessor? You have to be unbiased about the data that you collect. You need to get evidences and so on, so we can understand the maturity of the current state of the supply chain. And then we looked at data collection. The team started, we identified the sites that we need to visit. And it was a massive project. We had to look into 44 sites and assess them one by one. So the team, the 25 assessors were spread over 44 sites, traveling north, south, everywhere, you know. We assessed 10 healthcare directorates, 14 hospitals, 10 central and regional warehouses for medications, 11 healthcare centers, small healthcare centers, and we had this organized plan, who's visiting what, and what we are going to look at, and who's going to meet who, and so on, who's the right persons to meet, where do we want to visit inside the hospital, all these ideas to understand what is the current situation in data collection. Then we moved to data verification. In data verification, we wanted to collect all the evidences the assessors had for all the locations, and we tried to verify the evidences, the answers, the interviewing they did, the data they recorded, and so on. So I personally had to meet and interview again the 25 assessors. What have you done here? Show me the evidence. How did you do this? On what basis you think this is the right answer? Because the way the maturity model works is that you need to tick on multiple options of maturities and count on constraints and so on in a certain place. All right? So we verified all this data, and then it was the right time to analyze these data, put these data into reporting. Right? And I'm going to show you now one page of 44 sites report to see how does the maturity, the supply chain maturity look on those places. This is basically one of the outcomes for the entire 44 sites. Orange is the hospitals. We said different, we have like 14, 15 hospitals. Warehouses, we had something like 10 warehouses, regional warehouses. Healthcare centers are the greens, right? And if you observe the data, the lowest was 19% maturity out of 100, and the highest was what? 47%, right? This left all sites, all healthcare sites, in a supply chain maturity between canvas and bronze. Going back to the maturity levels, so all 44 sites were somewhere between canvas maturity and bronze maturity. What does that technically mean from a supply chain standpoint, being here at the lowest level of maturity? What do you think does it mean really? Sorry? There's no supply chain? Kind of. Kind of. It was, silo thinking, drug shortages, no accountability on supply chain, many things that I'm going to show shortly. So anyway, this was reported to the stakeholders and the minister that all sites are falling between canvas and bronze. And I still recall the discussion I had with the minister back then. And I started my discussion by saying, Your Excellence, I don't think anyone in the country can tell you today, as of today, how many paracetamols had been dispensed today. Because of all the supply chain issues that you have, you don't even have visibility over the network and so on. Right? And this was the starting point, the as-is, where we understand what is happening in every hospital, every regional warehouse, and so on. All right? No wonder that the citizen called up the local radio complaining about drugs availability. All right? We also, what we did, so going back to the model, so analysis and reporting included also counting the constraints that we have. So we requested the assessors to, wherever they see an issue, to try to understand what is the constraint behind it. Is it technology that's constraining? Is it process knowledge? So they don't know how to order material or how to replenish material. Is it human resources availability? Is it infrastructure issues that's supporting or preventing the system from doing what it should be doing, and so on? And we had a count for all the observations. And you can see, as a result of this count, that infrastructure, warehouses infrastructure, and so on, also enabling technology comes first. as the most dominant constraints that's preventing the supply chain from doing what it should do. We also had funding was the lowest, imagine. Funding was the lowest, very funny, huh? Because WHO was supporting, ICRC was supporting, and they did not have issues of not having money to procure goods. Very interesting, huh? Private-public collaboration was not an issue. Working with medical manufacturers, working with distributors was not the big thing, you know? The big things were the technology and the infrastructure in place. The absence of leadership, supply chain leadership in place was an issue as well. So now, as of this, we understand, going back to the as-is and the gap analysis. We understand what is happening everywhere, we know what is causing it, and it was time to think what needs to be done going forward. All right? Great, so now what? These are the findings that were reported as well. A fragmented supply chain function. A fragmented supply chain function. If you see this graph, this explains exactly what supply chain is all about. Supply chain is all these activities, physical logistics, distribution, adding to it strategic planning, customer relationship management, external integrated information systems, demand management, customer relationship, supplier relationship. So what we observed in that the entire network is that the supply chain function lives in silo. Every single department does not communicate probably with others. There is no data exchange between them. And most important, supply chain did not exist as a concept anywhere. They had warehouses, they had procurement, they had planning function, and that's it. Right? But nobody, there's no supply chain structure, there's no supply chain approach, there's no supply chain strategy. This is what we call it. So the guys lives in this era where we used to have every single activity by itself before we call it physical distribution and physical supply. All right? One of the main reasons why we have all these shortness and so on. The network itself was, so the distribution requirement planning approach was poorly executed. So what is really distribution requirement planning is where you plan to distribute material for the entire network. Right? What we figured out, so this is the whole network, very complex. Huh? Warehouses, directorates, hospitals, pharmacies, middle operations, north operations, south operations, working all together, as you see, in a very holistic, complex model. What we figured out, so they used to plan for inventory availability. What we figured out, the more you move in the network, you lose visibility. They lose visibility. Meaning, it is very hard for them to understand what had been issued today or dispensed or what is available at the network at any point of time. As such, how can you plan inventory if you don't know what had been issued today? Right? So the more you move into the network, you start losing data, information about the supply chain, and so on. So they had this poorly organized push-pull model where they request the pharmacies to order, but at the same time, they challenge it in a very odd way. So the pharmacy would order, or the hospital would order for the middle operations, and literally it goes like that. The pharmacy would order 500 pieces. The middle operation would come back and say, I will give you 100. That's it. But I need 500. No, I'll give you 100. It's kind of rationing stock, but at the same time, so I asked him, what about the 400 pieces that went into back order? You know, I had the most odd answer in my life. He said, well, we wait. If they ask again, we give them. If they don't ask for the 400, this means they never needed it. Imagine, this is how the planning model is working, huh? Like challenging and rationing and so on. And I'm talking to pharmacists, planners that are pharmacists that know nothing about planning and forecasting and all these things together. So it was, you know, for someone that works in planning or educates on planning or advocates planning, that was extremely odd to me to hear about the rationing story and the fact that they If they don't ask for it, I'm not going to deliver it, right? So, more findings. Deteriorating infrastructure. I think that the logistics infrastructure was built on the 60s or 70s and still operating in the same manner, right? Without maintenance, without upgrading, and so on. And I'm going to show you very interesting pictures when we talk about infrastructure. These, during our visits at the warehouses, sub-warehouses, main warehouses, and so on, I had to take some pictures, you know, and not me actually, the assessors had to take some pictures. So this is one of them, for example, where birds are nesting inside the warehouse. So when I asked them why birds are nesting inside a warehouse, this is you know, it's a medical warehouse. Huh? They said because the windows are open. Why? Let's do 5 Huh? Why the windows are open? They said because we need ventilation. So the windows are open at warehouses, you know, healthcare warehouses, medication warehouses all the time, dust, insects, birds, nesting, heat, you name it, all right? Deteriorating infrastructure, you know, built back in the 70s and 60s, and this is where they store their medications, as you see. And interesting enough, there is no racking system anywhere in the entire network. Why don't you have racking systems at the warehouses? They said, we're doing better without them. We just bulk things up, and there's less work to do, and so on. And they always complain about congested warehouses and everything else you know about warehouses. Deteriorating infrastructure. This is a warehouse for medication in the north that distributes medications and keep medications on the network and so on. And that's most interesting. So this is clear, huh? This is maintenance issues, electricity risks, and so on. But I would challenge you to know what practice is that? Inside a refrigerator. So one of the assessors took this picture inside the refrigerators where they keep insulin and so on. They use home refrigerators, by the way, to keep medications cold in the right temperature and so on. Any clue what is that? What could that be? Because I had to investigate this myself. What is this picture? What does it do here? What is the background? And so on. So they asked the pharmacist, any clue? Yeah? What is the temperature control practice? They asked the pharmacist, what is your temperature control devices where you measure the temperature? So she said, we don't have any. But alternatively, what I do is basically have ice, cup of ice, and I would keep the coin on the top. I was asking her, how do you know that, so you leave the warehouse, how do you know that the temperature went down or went up or electricity went down? So the temperature would, you know, fluctuate on insulin and other medications. She said, simply we do this. We put the coin on the top and we come the next day. If the coin is at the bottom, this means it has melted because electricity went down. And then temperature had changed, so we take an action. How's that, guys? For a healthcare system. Isn't it brilliant? Well, I was telling her, this is really brilliant. All right? I like the idea, but yeah, thinking supply chain, temperature control, medications, and so on. This is the outcomes of the assessment, huh? This is the outcomes of the assessment. This is what the assessor saw at the place. So yeah, so that was speaking of deteriorating infrastructure. Ad hoc planning. I had to meet with the planners at the central unit just to observe. I was lucky enough to see them doing the forecasting planning. How much we put here? I don't know, take an average. All right, no softwares for planning, doing ad hoc Excel sheets, historical data, you know, taking averages and so on. And it takes them like weeks and weeks of planning, you know, just to generate a forecast. Weeks of planning, you know, say this is our 4th meeting to plan and so on. So poor planning. Forecast accuracy was measured at 56%, actually. All right. This is not a company, guys. This is a national healthcare supply chain that serves millions of children, mothers, elders, sick people, vaccinations, and so on. All right? Lack of automation and visibility everywhere in the network. Small hospitals, big hospitals, small warehouses, big warehouses, central units. They claim to have Oracle in place, but literally doing nothing with it, just like the database for entrance and so on. As a result, answering the question, how many paracetamols were dispensed today, was impossible to answer, right? In the entire country. Human resources knowledge was the harshest parts for me. So at the warehouses, I saw all the warehouse team are pharmacists. And then when I asked this is, by the way, about technology as well. When I asked why the warehouse officer is a pharmacist, or he should be a pharmacist, he said, because he has or she has to recognize the material. I said, don't you have barcoding technology? Don't you have barcodes? I said, no. So the pharmacist is the warehouse officer, and he needs to check every single item, components, and so on to confirm issuing it. As if issuing material requires personal knowledge to that extent to issue that material. All right? Absence of supply chain leadership. So I visited I have done the hospital's visits, actually. And I failed to find one single individual there to talk supply chain to. Even when I went to the manager, the head of the hospital, he was either a doctor or something. So I asked him to take me to talk to someone about supply chain and understand the supply chain. How does it go? He will say, yeah, let's go. And he takes me to the warehouse. She's the warehouse officer. She will help. That's it, okay? Absence of leadership in supply chain for the entire network. Right? Are you guys in a state of shock? Yeah? This is how useful was the assessment. This is why we're running out of stock in a country, in a nationwide project, okay? So now, findings, as is, understanding the problem, we wanted to look into solutions. What could be done? What are our priorities? What is the way going forward? What is the to-be stage of this? And so on. Grant, this is yours.
Sure, and as you're mentioning, Sama, luckily there is a solution, and it's the SCOR model. So one of the solutions for sure to do this through. So not to go into the details of the model itself, but really the model takes a set of processes and looks at how can we standardize these processes? How can we do them better? What practices do we need to input into this type of supply chain to improve it? What skills do we need? From the competency level, and as Sam has mentioned, there was a serious lack of competency in that specific example. And of course, the metrics, right? What are we going to measure to improve our success rate? And what we like to do in the SCOR model is actually look at the strategy first. So before we even get into any metric or any quantitative metric, is to understand what it is that we want to do. And actually, this is a blessing in disguise that this was at a bronze and a canvas level. The blessing is that we can start from scratch, and we're going to implement the best practices to actually run this supply chain. So not to go into the detail of all of that, but basically we have different options. We could be reliable. We could choose to be able to focus on the predictability of the outcome. So when a customer places an order, when a hospital places an order, they know they're going to get it in time. We could look at cost. We could look at profit. In this case, probably not such a big one. We could even look at environmental and social aspects as the key drivers. All of those decisions are going to help to decide how to operate the system or the supply chain. So we have a quick question for you, last one in terms of questions. So if you can go back into your pollev.com/ASCM. And the question here is, in a public healthcare supply chain, which of the following attributes do you believe would be most important? Right? So think of this context. Rank them from highest to least least important, right? Most important to least important. So you'll see on your app, you can drag them up and down and put them in a certain sequence, and then you can click submit.
Yeah. If we shed light on what is really reliability, I'm not sure if everyone's familiar with the concept.
Yeah, so maybe just to quickly touch on those very quickly. Reliability, getting the order right as much as possible of the time. They place the order, they get it when they needed it, at the right time, quantity, documentation, and at the right quality level. Responsiveness, the speed at which they receive it. They place an order today, they get it tomorrow, right? That would be a quick, let's say a quick turnaround. So that's speed. Agility is the ability to react to unplanned increases or decreases in demand. So being agile enough to change the plan. Cost, how much does it cost, right? Expensive or cheap? And the environmental aspects is, does it satisfy the requirements of the environment, right? Are we polluting heavily when we do this? Or are we saving the environment by not making any waste? So that's really the key there. So I think what we see here is the reliability came out as number one, and that absolutely makes perfect sense in this context. Responsiveness also quite important, actually, right? So being able to be quick around getting potentially drugs to the hospitals or the clinic groups. So really interesting to see that there, and I think this talks very much to what we actually see in real life. So I'm going to move on, Sama, just in the interest of time.
All right, so the stakeholders of the project saw that for them, reliability was the highest priority. After all the issues that the assessment brought up, getting the right things in the right place was the highest priority for the stakeholders. Then agility, our ability to ramp up and down as needed, such as COVID, for example. And then they saw that responsiveness comes third, which is the time to deliver and so on. As we said earlier, cost was not the thing for them, because they had funding, and the issue was in the first place about availability. And when we calculated the reliability, it was at 39% at its best. The ability to get the right products in the right time with the right documentation anywhere was not higher than, in the best scenario, 39%. So these are the components of perfect order fulfillment or reliability. Perfect condition of material, delivery performance to customer commit date, percentage of orders delivered in full, and customer orders documentation accuracy. And these guys were at 39% at their best when it comes to reliability, right? And that was their priority. So our job was to try to enhance the state of availability, which is reflected here by the perfect order fulfillment and reliability. In order to do that, so I'm gonna zoom in now on the state of perfect conditions. You all saw the pictures, damaged material, poor infrastructures, and so on. So I'm gonna zoom into what have we done or what plans we had for the overall program actually. So the stakeholders and the assessors and us and WHO, so that these are the main streams that we want to enhance. We want to harness systems and technology usage to increase the visibility, our ability to see what had been issued everywhere, planning, and so on. We want to install new softwares. We want to create digitalization in the supply chain, right? Human resources, we saw an imminent need to educate and increase capacity among all the workers on the supply chain field. Different levels, from hospital managers down to pharmacists and planners. None of them had full idea or capacity to talk supply chain. And this has got something to do with the way they are hired. So there is something called capacity hiring, which means thousands will line up waiting for being hired in government departments, right? So no matter what you have learned at university, they will just call you and say, we have got job for you at warehouses. He would be a pharmacist, he would be an accountant, anything. He wants to work, so he would go and work in supply chain in this case. Infrastructure, we had severe issues in infrastructure, as you know. So we wanted to renew existing physical infrastructure everywhere for the supply chain, warehouses and so on, racking system, forklifts, etc. And then we wanted to look at the processes, how do they do planning, how do they do inventory management, and so on. And then organization design was the hardest among them all, actually, because this requires fundamental changes in the way the government is doing and regulating the entire supply chain, right? But then this brought up many projects, and the question was, where do we start from? We had to prioritize among this entire program of improvement. We looked at, so this I'm going to zoom again into the, as a priority for renewing physical warehouses and existing infrastructure and so on. We had to have priorities on where do we want to start from. So these are the 10 projects that were proposed to enhance the current state. And as you see, demand and inventory planning solutions, track and trace technologies, building a whole new centralized warehouse in the capital city, regulation changes, recruiting process, department hierarchies, introducing cycle count, barcoding technology, capacity building, good distribution practices. So these were the 10 projects that we want to start with. But the good question is, where do we want to start? Some of the projects are expensive. Some of the projects are risky, takes a long time, and so on. So we prioritized what could be quick wins for us. And the quick wins were starting with barcoding technology, capacity building, good distribution, and storage practices. All right, so this for us was the starting point where we want to start with the quick wins. So as we speak today, we started all education programs for the entire sector, healthcare sector. We started implementing barcoding technology at warehouses to track and trace and label material and so on. And we are on the verge of implementing good distribution practices at the place. Luckily enough, there was a big question, who's going to pay for all that? All right, because the government most likely don't want to do this, but donors would like to do. So we were lucky enough to attract $4 million fund for all these projects by WHO. And that was amazing for us that we have funding so we can start with the program, actually. So now we have ongoing plans. For example, when it comes to the good distribution practices, we have 6 streams to look at immediately. Let's put good distribution practices everywhere, because the problem was in the perfect condition of material, the way they manage physically the network and so on. So we started installing climate control devices everywhere instead of the cup, yeah? And the cup and the coin. We started building and we recruited cold storage rooms inside the warehouses to keep the material at. And now these are synchronized and they send you a message immediately to your mobile in case of any temperature issues happens and so on. We procured backup generators and they are on the delivery, so we won't have these disruptions in electricity and so on. They don't believe in racking system. None of the warehouses had racking system. So we are commissioning racking systems for all warehouses now to enhance the flow of material, storages, and so on. Firefighting system, maintaining and installing them, track and trace technology at the warehouses. So this is just one tiny piece of operations, one of the projects for good distribution practices, which was part of how we want to enhance the perfect order condition of material, because we wanted to create higher reliability percentage in the supply chain to solve the underlying issue that we had been discussing. All right, what's next? So we have now 4 years project plan with the government and WHO. Our intention is to make the entire government rethink healthcare system in relation to supply chain management. How to use supply chain to enhance the current state that they have, right? Our overarching goal also is to create patient-centric supply chains, right? Patient-centric supply chains that adapts, moves according to the status of the patients, actually. Supply chain that understands the criteria of customer satisfaction, which in the healthcare sector, and definitely improving patients' experience and public healthcare through supply chain. These are the aims of the 4 years project that we are still undergoing. So we expect to finish this, the entire program, hopefully in 4 years' time. That was my story. I hope you liked it. Thank you very much. Good one.
Thank you.
Do we have time for questions? Yeah, I think we do have 10 minutes left.
We do.
Or actually 5 minutes.
Have we got any questions for Samer and Grant? No? No questions?
We'll provide an update next year.
Yes,
there's
please.
a question.
Yeah, of course. So one of the things that was not mentioned here is that we had a scorecard of how we started measuring that, and now we have a scorecard to see where are we going with perfect order fulfillment. But still, it's even with the quick wins, I wouldn't say we can track this immediately now as we speak, or we have to wait for 3-4 months until we finish the infrastructure program to see how is this going to enhance, especially when it comes to the perfect condition of material, right? Yeah. And the essence of SCOR implementations is that you keep a tracking of a scorecard that shows how the measure changes and so on. Questions?
Thank you. Any more questions? Okay, then I'd just like to thank Samer and Grant for a fantastic presentation, and I think it's a fantastic project. When are you going to move into South Africa and do the same?
My pleasure. My pleasure. I think the highlight is this is a whole country program. You know, when we talk about 44 healthcare sites and figuring out what is going there and what needs to be done is really massive big. I'm so lucky that I had the chance to go into this experience actually with WHO and the local government. And I love the fact that the Minister of Health is embracing it. Like he keeps sending messages. What are the updates? I swear, what are the updates? Meet me next month. We need to understand what is happening. And also WHO keeps calling me like, what are the updates? Where are we now? What is the project status? What is happening? And so on. So this is very interesting. It takes leadership as well in order to transform a governmental structure to embrace more supply chain thinking. Visionary leaders. All right.
Okay, thank you very much.
Thank you very much.
Don't forget to fill in the review on the Uber app. In the old days, we used to have students standing at the door, and they wouldn't let you out until you filled in the form. But yes, please fill in the Uber form there for the presentation. Thank you.
Thank you.
Thanks.